Hi friends, I am Dr. B.V. Rao of Pusha Clinic and founder of the websites qmedicaldoubts.blogspot.in and raghavamedicaldoubts.com. Through these videos, I am providing the basic knowledge about the commonly occurring diseases, treatment and surgery details when necessary, further medical knowledge to general people and for reference to medicals. Today I am going to discuss about the psychological problems and the types. Psychological problems are so prominent in the society that many of the problems are left untreated. In the milder form, most of the problems are treated by the general physician. The psychiatry deals with the three large groups: major disorder, the minor disorder, and the mental retardation. The major psychiatric illness of psychosis interfere with the patient's thinking, perception, feeling so profoundly that at times what he says to his neighbors no longer makes sense to them and is regarded as insane. Minor disorder. This group deals with the patients with less gross disorders who remains in touch their surroundings. They suffer from psychoneurosis, personality disorders, psychosomatic illnesses, sexual deviations or addictions. The other is mental retardation. Mental subnormality is a congenital condition may start from birth or early age. Unlike other forms, classification. In brief, they are divided into two groups: organic and functional. Organic psychosis. In organic brain syndromes, functioning of the brain is impaired maybe by physical lesion like trauma, tumor, infection, toxic or degenerative process. Delirium. The organic brain syndromes when acute are known as delirium. For example, a toxic confusional states occurring with brain trauma, cerebral anoxia, infection or intoxication with barbiturates, amphetamines or alcohol. Dementia, the chronic psychosis, where an irreversible brain lesions has occurred are called dementia. The most common are ones associated with advancing age, atherosclerosis, senile psychosis, etc. Mild dementia. The patient is forgetful, easily confused, irritable and emotional. More severe dementia causes disorientation, gross loss of memory and deterioration in personal habits. Functional psychosis. These are the major psychiatric illnesses occurring without brain disease or impairment, which is so far have eluded all attempts at explanation in terms of physical or biochemical pathology. The most common forms are manic depressive psychosis. The principal symptom is a profound disturbance of the patient's mood. Schizophrenia. The patient's thoughts become bizarre and strange, so that he loses contact with fellows and surrounding. The psychoneurosis. It is the most common form of psychiatric illness encountered in general medical practice. They are subdivided into anxiety neurosis, hysterical neurosis, obsessive compulsive neurosis, phobic neurosis and depressive neurosis. Personality disorders. The patient's personalities differ markedly from that of a normal population. Their abnormality takes the form of a recurrent disturbance in relationship with other people. In addition to this psychosomatic illness, sexual deviation, alcoholism, social difficulties, they present traits like hostility, passivity, may not be same degree in the behavior of normal people. They are distressed by their irritability to get on constructively with others and often seek treatment. Otherwise, it may lead to psychoneurosis or psychosomatic illness. Those with gross disorder interfere disruptively, otherwise called sociopathy, which their relatives and associates and may come into conflict with the law. They won't regard themselves as abnormal and reject any effort to get treated. Psychosomatic illness. This is the common illness caused or prolonged by the common illnesses like asthma, peptic ulcer, dermatitis, ulcerative colitis, etc. Sexual deviation. In patients, the patients are deviated from the normal sex patterns when become problem to the society or themselves. Disturbed by their deviation may consult a psychiatrist. It may lead to depressive illness or paranoid relation. Drug addiction. An addict is physically and psychologically dependent on a drug and suffers distressing side effects when deprived of it. Alcoholism. An alcoholic is an excessive drinker or alcohol who is unable to stop drinking in spite of ill health, marital strife, or difficulties in occupation. Mental subnormality. It may be of two types. Although the intelligence level is below normal, IQ is below 80, the child may be benefited from teaching and social training. Severe subnormality refers to those so handicapped that they require very considerable attention and support and are incapable of leading independent existence. Examples may be Down syndrome, Mongolism. Other conditions causing it may be phenylketonuria, cretinism, etc. These patients may also suffer from other mental illnesses like depression, schizophrenia, but when happens, the symptoms of their mental illness will be modified by their basic handicap of mental background. That's all about the psychological problems and classification. And in the next video, I will discuss about some other disease. Thank you.